We have to market about our leadership qualities. We have to tell to the public that we are the leaders.
You are listening Nursing Leaders Opinion, crafted by Nursing News India. Today we are going to talk with Dr. Rajeshwari, who is a community health nursing expert and educator. Hi Dr. Rajeshwari.
Hello.
Please tell us about the journey you have been through in your career.
I have done my till 12th standard in Sainik School, Korkonda, Vijayanaram district. Then I have joined my BSc nursing into 1980 to 84. I did my BSc nursing in Government College of Nursing, Somajiguda. After that, I worked as a nursing tutor in School of Nursing in Andhra Malasabad. Then I went to Saudi for 13 years. From 1993 to 2006 January, I was in Saudi. Like there, I worked like a staff nurse, head nurse, nursing supervisor, and chief nurse or nursing director. All posts I have, I have taken up there in Saudi Arabia. Then after coming back, I did my master because with BSc I went to Saudi. After I came back, I did my masters in NIMS, Nizam Institute of Medical Sciences. That is a deemed university, and it is I was in the first batch of MSc nursing in NIMS. After that, I did my MBA in healthcare management. Then now I'm still pursuing. Viva is waiting for my PhD. So this is like my career, whatever no, I have passed through the career. And now after I became TNA president of Telangana state, I came with so many, and the people, with the representations, people came with representatives. Now, especially in Telangana, people came to know that through TNA only we can solve the problems. So they have approached me and they were asking me like, ma'am, these are the problems. So I have gone to minister, health minister, like with the representations, but still we could not get the things done. So it's already 7 years. We were trying for the betterment of our nursing profession in Telangana, but we could not. So that is the reason I thought, let me go for this MLC so that I can do something for the profession, for the development of the profession and for the betterment of the nursing professionals.
You have mentioned that you served in Saudi Arabia. Could you tell us some of the memorable experiences you had while serving?
I went to Saudi. There only I worked for 13 years, but I have started my journey from staff nurse, bedside staff nurse. Then I became a head nurse. Then I became a nursing supervisor. Then I became chief nurse ward hospital nursing director. So these are the cadres like I passed through with my talents and my skill, my knowledge. People has recognized me, and I could go through all the phases of my profession there. And it was really like, I could manage the situations, crisis, handle the things even in the staffing crisis period. See, staffing crisis is there everywhere throughout the world. We cannot say that there are staff available, plenty of staff to work in the ICUs or work in the hospital. But everywhere, wherever we go, it's really still we lack. We are only 50% of nurses, nursing professionals working. So still we lack. We have staffing crisis. In spite of staffing crisis, I could manage the things in such a way that, like, we were able to. I was working in King Khalid Hospital in Alkaj, and we could start another new hospital. And as in under my supervision, I could arrange all the things, and we could start a new hospital under my pursuit. Whatever during my time, what are the things needed, how it has to be done, and it was inaugurated by the Prince of that Saudi has come and inaugurated the hospital. So, and there was easily in Saudi Arabia, like we used to have RTS, road traffic accidents, very often. And we are in such a way that we are prepared because with the drills and all, we could manage very easily. We could handle the things and we could survive the people without losing the lives of the people. So I learned so many things in Saudi, and moreover, like when we are empowered with the knowledge and skill, really people will keep us in heights. The Saudi people used to respect us like anything, because and moreover, my hospital director was a Saudian. He's a surgeon and a very short temper person, but still I could manage. So people used to give me, like they will call him as Mudir, and they used to call us like in charges and hospital nursing director. They used to call like female Mudira. They used to tell. Wherever we go, that respect used to be there. The recognition for the work, what we are doing and how we are doing, we used to have the recognition there. In foreign countries, they really like the people like who are empowered with knowledge and skill. If we are having both, I think, and when we are confident, our services are really recognized there. When compared to our native place, wherever we are working in India. So yeah, I really had a good time there in Saudi, and in so many disasters, crisis time, I could manage easily with my staff. And when I was on duty, like a supervisor or a head nurse or whatever it is, my staff were really confident. They are very much like a cover. They don't have any tension that my head nurse is there, my supervisor is there. She can manage the crisis. This is what, I'm not boasting myself, but people used to tell me, ma'am, you can manage. And there was any crisis, any road traffic accidents, any disasters. Really, I never faced a problem in managing the things when I was in Saudi. And I learned how to handle the things, how to handle the crisis part in Saudi. And it was really good experience, and which was not, we are not able to practice in our country. Especially there now, like every 6 months, it's a must that everybody should go for a fire drill, everybody should have a disaster drill. And code blues, it is emergency. Like n number of code blues I might have attended. But when it came to India, like, especially where there is NABH or JCI, maybe those people will be knowing about the disaster drills and all. But other side of the hospital healthcare system, still people don't know how to manage the disasters. So at one point of time, I really thought that I have to go for educating the people for this disaster management and all, but I could not materialize it. And wherever there is a chance, really, still I feel like people has to be prepared for the emergencies, for the disasters. Like how the COVID made us, like we frontline warriors, we were not prepared, but still we could manage. So if we are trained for preparedness, disaster preparedness, this is one of the disaster what we were facing, still facing. So if we are really prepared well, I think we can manage whatever may come on the way for us. We can handle the things.
Could you shed some light on the current scenario of teaching nursing and how you feel it differs from the past?
Yeah. I finished my nursing in 1980 to 84. When we don't have research, especially nursing research was not included in the curriculum, but now it is included in the curriculum. And those days, like whatever no we were doing, whatever we are learning, the scope was less in the olden days. Only bedside, or whether we have to work in the bedside, or we have to work in the public health, or only in the teaching side. Only these three things used to be there where we have to work there. But now the system is changed. There is plenty of scope for nursing. Research is included in the system, in the curriculum, and the topics were, more like, the computer, this and all, we were not having. Those days, we were not knowing how to handle the computer. But now each and every person is well versed with the computer. They are updating their knowledge. and they are doing all the typing work, whatever. I mean, the system, IT is information system is there now. That was not there. So it is really different, and we are showing the way to the girls, the path where they whichever way they want, they can go. They can work in the school as a school health nurse. They can work in the industry like a occupational health nurse. They can go to the, I mean, wherever, like even in the what we will tell, like first aid or home care. I mean, wherever, whichever direction they want, the scope is available now. Military nursing or whatever, whichever way they want, they can go. But in those days when we were studying, only fixed things. And people are also like parents, they don't want us to go to the hospital services. They will tell that it is not good if you go to the hospital, you go to the teaching side like that. But now we know the difference. If we are working in the bedside, like we, even in the bedside, there are, so in the clinical side, people were given respect. There are the posting like nursing, nurse educators, nurse supervisors, floor floor managers, general managers, CEOs. I mean, the different posts are there now for the nurses. So the student nurses now who are having, I mean, the education, they are really blessed whichever way they want. Like if they want to go in I mean, teaching, they can go for teaching. If they want to the clinical side, they can go. If they want for the clinical research, they can again go to the clinical research part. And if they still they want to change their profession, like MBA or healthcare management, they can go that. But those days only straightforward, like you go to the clinical side, bedside, or very few people used to go for the teaching. So there is really difference between the previous, past and present, the education part, and how we are. The curriculum is completely changed, and the clinical hours were more, the curriculum, like the way we are teaching, it's like a comprehensive healthcare what we are teaching them, how to manage the comprehensive care. We are the approach, how they have to handle the patient, everything we are teaching them. But those days only patient care means patient care.
Do you think that some areas of community health nursing in India needs improvement? How would you compare our community health nursing to that of other countries?
Yeah, community. See, the system is like in the community, like the patient who, all the families are to be attached to the community health center. So the community people, community health center or the medical center, wherever I mean, in the community, they should have all the records of the community people who are there in that particular community. When that is there, automatically the rapport will be there with the patients or the family members or the community people. So this is somewhat like family health. We are telling family health. We are going and doing like home visits, taking care of the family members or patients in the families. But still, that is, we are not that much into the family. But in foreign countries, if it is only family health, means they completely depend on the family health. They will see to that the complete prevention or whatever preventive part, promotion of the health will be taken care. If they really need, the patient has to go to the hospital setup. I mean, to be seen by the doctor, that is the time only they're going to send the patient to the doctor. So here I think we are still lacking because of the practice. We are not having that community health practice. If we have that practice, nursing practice, community health practice, then midwifery practice, if these courses are there, I think that is the time we will be overwhelmed with the knowledge and we can handle the things. But that is still not going on with us, because even especially in our state, Indian Nursing Council, they wanted to start family practice and nurse practitioner course. But still our government and our universities, they have not started. So if that is started, if a nurse practitioner course for the bedside, I mean the for like med-surg people who can handle the nurse practitioner, they can practice nursing at the same time family practitioner course. community. The community people can take a family practitioner course. So we will have our own family patient, like the family doctors, how we call the doctors. I think we will be calling like family practitioners. So we will be having families as our clients. We can handle them, we can counsel them, we can educate them. But this is what not happening with our country still. And still we are lacking in that. If these things, the gap is bridged, whatever Indian Nursing Council is formulating the curriculum and giving to the people, if we are putting that into the practice and we start doing the things, maybe then we can improve our system, but still we are lacking in the community. We are not able to do the complete community health nursing care. We only during clinical part we are going. I mean, as a student we are taking them to the community area. There they are doing their no, whatever is needed, that part only they are doing. Then they are coming back. Only during exam they are going. Is that much only happening. We are not having attachment with the family. But when we are doing that practice, family health or community health nursing practice course or something like that, if that practice, if we are no, doing, automatically we will have bondage with the family, and we can see to the preventive and promotion of the health more better than the other things like what we are doing. So that part can be done, and our counseling part and preventive part we can do, and we can protect so many people from not getting into the diseases, even the communicable and non-communicable both. When we are in close contact with the family, we can see to their lifestyle modification in case of non-communicable diseases, where they have to go for a lifestyle modification. If we are just telling and coming back, where we are going, and we are not having follow up with the families, what we are doing. Even the government sector people, we have ANMs there and ASHA workers. ANMs will be 4 or 5, and for the 5,000 population or 10,000 population, how they will manage to handle those people? So they have ASHAs now. Each one ANM will have 5. ASHAs are somewhat like volunteers. So they are depending on these volunteers. How far they knows? They are doing the things because the government is educating them. They are taking some class, but still they are, I mean, not up to the mark like us. They're not qualified. They don't know the medical terminology or medical pathology behind the things. They just know what is diabetes, rise of blood sugar, something like that only. They don't know what is happening with the patient. They don't know the pathology behind or physiology going on. These things will be learned. I mean, we learn those things. If we are practicing, we will go in detail, all those things. And I think we can do a better in serving the public when compared with the present situation. So I feel that still we are lacking. We are not on par with other countries coming to the community health nursing. So if we start our nursing practice community, if we are given permission to practice, once we start practicing, then we will be having our own families. When we handle the families on the whole, maybe we can show some difference in communicable diseases and non-communicable diseases status in the country. So this is my feeling, what as a community health nurse, like what we can do and how best we can help if we are doing in a better way. And moreover, our services ought to be utilized. Community health nursing, I mean, qualified community health nursing personnel, MSc personnel will be somewhere working in the college or somewhere working in the hospital. If she has been given in charge of one particular tuberculosis program or malaria program or some program by the government as a project manager, something like that, maybe that is the time we can see some difference. Because whatever she learned, maybe she can practice there and she can make use of her knowledge and skills there. So this is not happening. We are not practicing it. So this, if we do all these things, I think we can bring a change in the community health nursing in India.
You are going in the politics. Can you please shed some light on this and share the present progress with us?
Actually, no, there was no idea that I have to go into the politics. So what happened, like what made me to go into it now for this election is, first of all, I am the president for TNAI Telangana. And with this, I got so many representations from government sector as well as private sector nurses. So with those representations, I have seen health minister, but we were not able to solve our problems. And this time, what happened in the month of October, there is an announcement that for graduate MLC elections, we can enroll. They kept, government has opened a link and they told us all to enroll. Like we can vote for any graduate in the, no, in our constituency. So that time we forced the people, I mean, nursing people, we came to know that we nurses also can vote during that MLC graduation elections. Previously we were not involved in those elections or in those no, enrollment or something like that. So when we were enrolling, we could make enrollment for so many nurses. So when we saw that at the end of November, December, we came to know that there were around 40,000 nurses. Total 6 lakh people have enrolled for this MLC elections. I mean, total 6 lakh people are there to vote for this MLC election. In that 40,000 were nurses. So we thought like we have so many problems. At this juncture, if we go and vote for somebody who is not doing, like previously the person who is there already in that MLC is from BJP. And he is for 2 terms already. Since 8 years, he is the one. But he never done anything for the graduates. And especially for our nursing personnel, we don't know who is he. This is the situation. So in that thing, and moreover, during the elections, all this assembly election, parliament election, people will give bhashan. They will tell that we will do this, you have this problem, we will solve this problem. I mean, n number of promises they are giving. But at the end, once they are elected, when we go to them, it is very difficult to get their appointment and it is very hard to get our things done. So we thought, why we have to give vote for somebody and make them to win? Why can't some nursing personnel stand on behalf of all the nurses who can raise the voice? At that particular juncture, what happened? Actually, I was working with Apollo College of Nursing as professor. And it was my 58th year. As per Indian Nursing Council, it is 70 years. Like as a faculty, I can work there. Throughout India, 70 years is the age limit to work as a faculty. In Apollo also, we thought 70 years is the age limit because in the guidelines and everywhere they have mentioned 70 years. But for non-teaching faculty, they have mentioned 58 years. And all these years it is going on. But this year, I don't know, due to the COVID or what is the thing, what made them to make it for even for teaching faculty, 58 is the retirement age. And one fine day on September 6th, they came and told me that, madam, this year you are retiring. You have to retire. So till that time, I don't have any idea to go into the politics, but I cannot force them that I want to stay back there with them because they mentioned that it is my retirement and it is their policy. They cannot break their policy for my sake. So I just left it. I mean, it's in the God's plan, like whatever it may be. So I thought, okay, let me take up. So that is the moment, like after 1 month or 2 months, this election point has come. Then I thought, okay, I don't have a government job. I don't have any job. And I am a TNA president. I mean, already president for one association, professional body, where I'm getting so many representations with the problems from both government and private sector. So let me take up. That is the time I thought, let me go for this election, contesting for this MLC election. And throughout, I mean, all the nursing organizations in Telangana, like private organizations and government sector, The different organization people, they told me, ma'am, you go for it, we all will support. So that is the time I thought, I made my mind that okay, let me go for this MLC elections, and I have given my nomination, and it was got accepted. And total, I mean, I am contesting as an independent because I am not having any party support, political support, because I don't come from a background of political people, so I don't have any political influence or anything. So I thought, let me go for independent. And from the nursing sector also, nobody is there to compete with me. I am the only one person, and it is from all medical. There is nobody from medical doctor side, nobody from physiotherapy, nobody from pharmacy, no one from medical profession itself, medical non, I mean, nursing or paramedics. So I was the one person who is going to represent all this medical profession, I mean, all together combinedly I'm going to represent. So this is what like I have taken up. And my this campaign also, like I, as I don't have political support, I'm not going for a open campaigns or meetings or keeping big hoardings or something like that. I'm just no, we are concentrating on social media, WhatsApp groups, Facebooks, and going and meeting, only campaigning with the people, like our professional people. And moreover, we thought like we nurses, if we are enrolled, we have our own family members who are graduates. Most of them are having like, family members, maybe their children, maybe their siblings who are graduates. So we thought that along with our vote, we will get support from our family members and relatives. So with this circle, I thought I can go forward, can expect that my success at the end of this election. This is with that no intention I came into this, and people are really accepting me wherever I'm going. People are accepting me. All these days I went for government and private, and today also in Hyderabad I have done day before yesterday and yesterday. Today I went to Mahbub Nagar district, where really people were they were telling like, ma'am, it's really good decision you have taken. And our profession, like somebody like when they see na, like when they see the list of the people, who is this, maybe that day, oh, Rajeshwari Muppidi, she's a nurse. So our profession will be recognized. See, I thought that I have to raise my voice. At least people will recognize. Now, how many people are contesting? The total number is 93. 93. In that, I think around 85, 86 are independent candidates from different professions. Lawyers are there, engineers are there, teachers are there. From among all, I am the only one from medical, and that too from nursing. So nurse, oh, nurse also can stand. I mean, can contest. So, I mean, about the profession, people will be talking. And that is what made me to go for it. And we want to see our profession somewhere in heights. People has to know like our strength. When we are going and asking, maybe like 1%, 2%, 3, we are going and asking, maybe they are not understanding what is our strength. When we see, if the people will see in these elections, if God's grace is there, if I get the majority, people will come to know, the political people will come to know, this is the reason nurses are coming forward and asking for this, like. So I thought I have to do something for the profession. And really for the development of the nursing profession and for the betterment of nursing personnel who are there in Telangana, I have taken up this, and I hope we can do something. I can bring some change in the profession if I will be elected as an MLC. And I won't say that the success or the victory is mine. I say that the victory, if I am the winner, winning this election, the victory goes to the nursing profession and to all the nursing fraternity, because it is not the single person who, I mean, it's not me alone. complete representation of the nursing I'm going to give. So this is what, like, to uplift the society, my nursing profession in the society, I have taken up this.
Do you have a message you would like to convey to the nurses?
Yeah, see, other nurses, because especially this year we all had celebrated Women's Day. In that context, I just wanted to say that we are women, and we are inborn. We have an inborn character of leadership characters we have from the birth. I mean, somewhere or other, we are showing our leaderships. From as a girl child, as an elder girl in the family, as a woman in the family, as a wife, as a family member, we are showing our talents as a leader in the family. And moreover, we are female and nurses. I think we are somewhat in a better leadership qualities what we have to show. So I tell that to all the nurses, they have to empower, they have to update their knowledge first. Whatever the latest technology is coming, going, I mean, we have to update ourselves. That is the reason we have CNE programs and all. So I request all the nurses to go for the CNEs. They have to update their knowledge. When we are updating our knowledge and empowering ourselves with knowledge and skills, I think we will become more confident to face the things. And by that, we can show our leadership qualities. And moreover, we have to market about our leadership qualities. We have to tell to the public that we are the leaders. So when we are to manage a single ward as a staff nurse also, we should have some leadership qualities. So that means each and everywhere we have to show our leadership qualities. So we are doing silently. Whatever work we are doing silently. But it is my advice that we have to open up our voice. We have to raise our voice. We have to show that we are leaders. Accept the things, do the things, but still we have to tell that I have done in my presence, I have done like this, because of me, this has happened, something like that. We have to market ourselves. Otherwise, we cannot, people won't recognize. Especially for nurses, there is no recognition. They won't call us and tell that, oh, good, you have done this. It's very rarely it happens. But when we market ourselves, more people will come to know about us. So my simple advice to all the nurses, update yourself with the knowledge and skills, so that you are confident you can do anything, and you market yourselves. Somebody will come and say, nobody is going to come and ask us, you do this, you do that. If you do like this, you will be a leader. No. We have to show that we are leaders. We can do the things. So this is what I want to give an advice to my people.